If you're going to Medicare soon, there's one thing that you're really thinking about, or at least you should be, and that is how much is Medicare going to cost me? There are lots of beneficiaries out there, or soon-to-be beneficiaries, that believe that Medicare is going to cost them $0. It doesn't cost anything, right? I've been paying taxes my whole life. That's been covering my Medicare. Well, that's not completely true. Medicare is not going to be free. Even though you do see some marketing, you see letters, TV commercials, you get phone calls, you hear agents talking about Medicare is free, $0. That's not the case. There's lots of costs that you need to consider, and that's what I'm going to talk about in these next few moments. Now, before I start talking about these costs, I do want to invite you to follow the information in the description of the video below to talk to one of our agents today. Nothing replaces talking to an agent. They can tell you exactly what your costs are going to look like personally for your situation. I'm going to go over a high overview of what that's going to look like for most people. So what you need to consider, what Medicare really costs. Medicare is not going to cost you $0. I'm not going to do that. But what you need to understand is that Medicare is made up of parts A and B. That's your original Medicare, Part A and Part B. Part A is your hospital coverage. Part B is your medical coverage. And what you need to understand is that they do have premiums. Now, as long as you've worked, or you or your spouse have worked for 40 quarters, which is roughly 10 years, Medicare Part A is going to be a $0 monthly premium. So we're good there. That is a $0 premium. And that may be what you're hearing about, $0 or free, which is really beneficial. However, Part B of Medicare, just this year in 2026, is at $202.90, $202.90. That's how much Medicare Part B is going to cost. And really, to have the full Medicare coverage there, you have to have both of these. Part A is not going to cover your things like outpatient surgery or doctor's appointments. It only covers hospital. So you have to have this, which is going to cost you $202.90 a month. That's something that you really need to understand. A lot of people don't realize that because it's taken right out of their Social Security check. But it will be what you pay for Part B. And then after that, I could have, let's say I have a Part D plan, a prescription drug plan. That's Part D of Medicare prescription drug. On average, that's going to cost me somewhere around $35 a month. So something else you need to consider. And then maybe I want to go Medicare supplement. We call that MedSup in the industry. Those are typically going to be somewhere around, we'll call it $150 a month. So you can see right away, one thing you need to consider is premiums alone can add up very, very quickly. We're talking around $400, maybe $350 to $400 in premium just off these three policies alone, Part B, Part D, and your Medicare supplement. So Medicare is certainly not free. Now, the good news is going this direction, everything else is going to be very predictable. Some people like to go with what we call a Medicare Advantage plan, or an MAPD, and those are typically $0. And they are going to get you drug coverage, and you wouldn't need a MedSup, a Medicare supplement in that situation. So this is your lower cost option, but you're going to spend a lot more out of pocket on our next few costs as I get into that. This is your most predictable option, but your premium is going to be higher. So that's premiums. Definitely need to understand premiums. Next, you need to understand what your out-of-pocket costs are going to be. So let's talk about somebody that goes to the MedSup, Medicare supplement, plus a drug plan option. Medicare supplement plus a drug plan. If somebody goes Medicare supplement and drug plan, the costs get very, very predictable. Of course, I've got my premiums here, $202.90, $35, and $150 that I have to pay. By the way, I'm going to pay that $202.90 no matter what direction I go. I have to add those up. That'll be my premium. But my out-of-pocket costs are going to be very predictable. Worst case scenario, on a Medicare supplement, my yearly costs for medical and hospital-related expenses are going to be $283 a year if I'm on a Plan G. But $283 a year is all I'm going to spend on hospital or medical. Very, very predictable, very easy to understand. $283 is the most I'm going to spend out of pocket for my services. I pay for my premium, then I pay very little. On my drug plan, I could spend up to $2,100 in a worst case scenario. So what you're seeing here is between drugs and medical, by going Medicare supplement with a drug plan, worst case scenario, I'm looking at right at $200 or $2,400 in a worst case scenario. Very predictable, very low cost. Many people love these plans because it's so low cost. If I go Medicare Advantage, or what we call MAPD, Medicare Advantage or MAPD, what I'm looking at is my premium is lower, right? I still got to pay that $202.90. That's not going anywhere. But now my out-of-pocket cost in the worst case scenario, my max out-of-pocket on this direction could be my PPO max out-of-pocket, which could be $14,000, plus my drug max out-of-pocket, which is $2,100. So I could spend over $16,000 even though my premiums are $185 a month lower. So if you do your math, going this direction is much more predictable. Sure, you save money up front here, but in a worst case scenario, you can really be out a lot of money. So when you see that this plan's free, when you see that this is not going to cost you anything, please be aware that the cheapest plan is not going to be the cheapest plan. And then other things you need to consider: dental, vision, and hearing. You have critical illness, or we like to call cancer, heart attack, and stroke. You have long-term care, short-term care. These are all things that are not traditionally covered by Medicare that you need to consider. Maybe you need to purchase an additional policy. That would cost you extra premium. If you don't pay the extra premium, you're taking the risk of paying this out of pocket. Either way you go, you got to figure out what direction's right for you. So no, Medicare is not free. There's a lot of costs associated, and it can almost feel overwhelming. What we want to do for you is sit down, have a conversation, figure out what's right for you, and put you in the best spot that you can be, where you're not going to break the bank because of your health insurance cost associated with Medicare. Please follow the information in the description of the video below. Talk to an agent today so that we can get you set up on a budget that works for you. Medicare is a journey. We're a compass. Use it.